Welcome. Today, we're exploring Pelizaeus-Merzbacher disease, or PMD, a rare and devastating neurological disorder that primarily affects males. PMD impacts the central nervous system, specifically the brain and spinal cord, leading to a range of debilitating symptoms. Join us as we delve into the causes, effects, and current understanding of this challenging condition. The root cause of Pelizaeus-Merzbacher disease lies in a genetic mutation on the X chromosome. Specifically, mutations in the PLP1 gene are responsible. This gene provides the instructions for making proteolipid protein 1, or PLP1, a crucial component of myelin. Because it's an X-linked recessive condition, males who have only one X chromosome are primarily affected. Females with two X chromosomes can be carriers, potentially passing the mutated gene to their sons. PMD is primarily a dysmyelinating disease, meaning it disrupts the formation or maintenance of myelin. Myelin is a fatty substance that insulates nerve fibers in the brain and spinal cord, allowing for efficient transmission of nerve impulses. The PLP1 protein is critical for proper myelin formation. When the PLP1 gene is mutated, the production of normal PLP1 protein is impaired, leading to poorly formed or absent myelin. This disrupts the communication between nerve cells, resulting in the various neurological symptoms associated with PMD. The severity of the disease often correlates with the specific type and location of the mutation within the PLP1 gene. Pelizaeus-Merzbacher disease is a rare disorder. Its exact incidence is difficult to determine, but estimates suggest it affects approximately 1 in 200,000 to 500,000 births. Due to its X-linked inheritance pattern, it is predominantly diagnosed in males. While PMD occurs worldwide, reliable epidemiological data remains scarce. The signs and symptoms of PMD vary widely depending on the severity of the disease and the specific type of PLP1 mutation. Common symptoms include nystagmus, which are involuntary rapid eye movements, hypotonia, characterized by low muscle tone or floppiness in infancy, delayed motor development, such as difficulty sitting, crawling, or walking, spasticity, which is increased muscle tone and stiffness, tremors, ataxia or loss of coordination, and intellectual disability. Seizures can also occur in some individuals with PMD. The onset and progression of symptoms also vary. Some individuals may show signs in early infancy, while others experience a more gradual onset. Diagnosing PMD typically involves a combination of clinical evaluation, neurological examination, and genetic testing. Magnetic resonance imaging, or MRI, of the brain can reveal abnormalities in the white matter, which is the area where myelin is located. However, MRI findings alone are not sufficient for diagnosis. Genetic testing to identify mutations in the PLP1 gene is the most accurate and definitive method for confirming the diagnosis of Pelizaeus-Merzbacher disease. Additionally, evoked potential studies can assess the speed of nerve impulse transmission and provide further evidence of myelin dysfunction. Pelizaeus-Merzbacher disease can be classified into several subtypes, based on the severity of symptoms and the age of onset. The most common subtypes include classic PMD, the most severe form congenital PMD, which presents at birth or shortly thereafter and is generally the most severe, and spastic paraplegia type 2, or SPG2, a milder form of the disease. Like disorders are also recognized, characterized by similar symptoms but caused by mutations in genes other than PLP1. Each classification has varying levels of severity and symptoms that are associated. Currently, there is no cure for Pelizaeus-Merzbacher disease. Treatment focuses on managing the symptoms and providing supportive care to improve the individual's quality of life. This may include physical therapy to improve motor skills and prevent contractures, occupational therapy to assist with daily living activities, speech therapy to address communication difficulties, medications to control seizures, tremors, or spasticity, and assistive devices such as wheelchairs or walkers to aid mobility. Nutritional support may also be necessary to ensure adequate growth and development. As PMD is a genetic disorder caused by mutations in the PLP1 gene, there are no known preventative measures that can be taken to avoid the condition. However, genetic counseling is highly recommended for families with a history of PMD. Genetic counseling can provide information about the risk of having a child with PMD and discuss options such as prenatal testing or preimplantation genetic diagnosis. The prognosis for individuals with Pelizaeus-Merzbacher disease varies depending on the severity of the disease. Individuals with severe forms, such as congenital PMD, often have a significantly shortened lifespan. Those with milder forms may live into adulthood, although they typically experience significant neurological impairments. Recent research is focused on developing gene therapy approaches to correct the PLP1 mutation and restore normal myelin production. Other research efforts are aimed at identifying medications that can promote myelin repair or protect nerve cells from damage. While these approaches are still in early stages of development, they offer hope for future treatments that could improve the lives of individuals with PMD.